Nurses from across the country came together on Capitol Hill today to hold a vigil for nurses who have died from the coronavirus. Shoes were placed on the lawn of the Capitol building to honor those who lost their lives as they worked to protect the lives of their patients. These nurses also called on Congress to pass the HEROES Act to ensure nurses on the front lines have personal protective equipment during the pandemic. For more, the president of National Nurses United Union, Jean Ross, joins me now. Welcome, Jean. So lovely to have you with us. So tell us more. You want the Senate to pass the HEROES Act. What protections does that act provide for nurses?
Well, we want it passed, obviously, because of the economic assistance that's so badly needed for our working families and for state and local and tribal governments. But for us in particular, there are two things that are just absolutely critical. And one is that they fully start the Defense Production Act to make sure that we have enough equipment and it keeps coming in a steady supply and the equipment that we need. And there's a provision for a medical response coordinator, medical supplies coordinator. And that person needs to give us some transparency in where the equipment is, how it's coming along and being produced, where it's being delivered. The other essential part of the act would ensure a mandate for occupational health and safety, OSHA, that they promulgate a standard, an emergency temporary standard that ensures that all workers working under this pandemic get the equipment that they need, understand clearly how it is to be used, and keeps employers from locking it up and keeping it from us.
Jean, I mean, Americans are just so in awe of all the work that nurses have been doing during this pandemic. You guys truly are the frontline heroes, and the work just doesn't abate. States like Florida have seen record-breaking day after record-breaking day of new cases. Can you tell us how dire the situation is on the ground at some of these hospitals for nurses?
Our nurses there tell us they're working under horrible conditions. Even at best, you know, our hospitals in this country have a standard that they call just in time. So they don't like to have equipment, things in preparation that we would prefer to have to keep our patients and ourselves healthy and safe. And so it's led to this short staffing, which is shorter now than ever. It's led to decreases in the amount of equipment that we need, especially gowns in Florida right now. They are begging and borrowing from other institutions and buildings. It's gotten so bad, they are taking up on a med-surg unit, you're taking up to 7 patients and more. And when they're critical, this is not safe. They are putting adults in with labor and delivery units. All these things that we know just should not be done. And in a pandemic, become even more or less safe.
It's just terrifying hearing you talk about what's going on down there. Do we have any idea yet how many nurses have died from COVID-19 so far? Of course, the battle is far from over. But do we have numbers on that at this point?
We have at this point, we say over 160, I think we said in our memorial this morning. And it's actually at this point 164. About 110 of them are in hospital settings or were. And then the rest, the 54, long-term care nursing homes, medical practices, that kind of thing. It's getting worse.
And so, Jean, it's just terrifying. Jean, how crucial is it then that the HEROES Act passes through the Senate quickly? And do you anticipate much resistance?
Well, from what I've seen so far, there's been resistance for a long time, even before the pandemic. You mentioned we are heroes. People keep calling us that. Your heroes should not be dispensable. We're not expendable. We are getting sick. We are dying along with other healthcare workers. There are things our government can do. This is critical. We need everybody telling their legislators, get this thing through, get the economic assistance working families need, but please, please ensure that we have the proper equipment and enough of it, and that someone is overseeing the distribution so that we know the equipment is going where it's needed most and there will be a steady supply.
Jean Ross, thank you so much for your time. It's astounding that this even has to be a bill when it should just be the standard. Thank you so much for joining us. We really appreciate it. And again, thank you so much for everything that nurses are doing right now during this terrible time. Thank you.
Thank you for helping.